Have you ever checked your calendar and wondered, why is my period early this month? Or maybe you've asked yourself, is my menstrual pain actually normal? Then you are not alone. This afternoon, we are joined here to discuss about menstrual and reproductive health, which is affecting millions of people. We are here to separate facts from myths and help you understand what normal menstruation is, and also the need for us all to know our menstrual cycle. Hello, everyone. I welcome you all to Health Matters Podcast, your trusted space where we share simplified, evidence-based health information that helps you to make informed decisions for yourself and your loved ones. I am your host, Miss Inseidu, and as said, we are discussing menstrual and reproductive health. In today's episode, our episode is titled, Know Your Cycle, Understanding Menstruation and What is Normal. And to help me understand this great topic, we are joined by our special guests. They are in the person of, we have Madam Gladys Mensah. She is a midwife at East. Have you ever checked your calendar and wondered, why is my period early this month? Or maybe you've asked yourself, is my menstrual pain actually normal? Then you are not alone, because millions of people also have questions about their menstrual cycle. Today, we are breaking facts from myths, helping you know what normal menstruation is and the need for us to know our menstrual cycle. Hello, everyone. Welcome to Health Matters Podcast. Here is your trusted space where we share evidence-based health information that help you to make informed decisions about your health and your well-being. I am your host, Miss Inseidu, and throughout this July, we are discussing menstrual and reproductive health. Today's episode is titled, Know Your Menses, Understanding Menstruation and What is Normal. And to help us understand this great topic, we've been joined here on this show by wonderful and special guests in the person of Sister Doreen Jijo. Pardon me if I didn't mention your name well. And then Sister Gladys Mensah. Sister Gladys is a midwife at Eastern Okrum. And then Sister Doreen is a public health nurse at Efia Health Center. Help me to welcome them. You are welcome.
Thank you very much. Thanks for having us.
It's really great having you on our show.
Thank you.
So before we dive into the questions, back to you, our lovely viewers. To our old followers, we truly appreciate you a lot. And to our new subscribers and our followers, I especially welcome you to Health Matters podcast. Here, your health really matters. Don't forget to share, like, subscribe, comment, send in your views and your contributions, and they will all be greatly acknowledged. Get all your books, your pens, everything that you will need to put something down. Let's dive into today's discussion. I welcome you all once again.
Thank you very much. Thanks for having us.
Thank you so much for being with us. So let's start from the basics. Many women go through or have their period every month, but not all of them understand why it happens. So please help us. When we talk of menstruation, what is it about and why does it occur?
Okay. Thanks for the question. When we say menstruation or menstrual period, it is the shedding of the lining of the uterus. And when I say the uterus, I mean the womb. It's the same as what we call the womb. So every month, or as a woman, every month, um, your body prepares for pregnancy. So when the pregnancy does not occur, it sheds. The line of your uterus will shed and then come out as blood. And that's what we see as blood every month. So that is what menstruation is, or the menstrual period is.
Okay. Thank you so much. Is there anything you'd like to add? Thank you so much. So when the lining of the uterus sheds and then it comes
Comes out.
out,
Exactly.
because there is no sperm to fertilize
Exactly.
the egg.
Pregnancy has not occurred. There's
Pregnancy
no
has not occurred.
yeah, there's no pregnancy.
Thank you so much. And most ladies or girls think our menses or our period should come exactly every 28 days, like it's following a GPS direction. July 28, August 28, October 28, but our body doesn't actually work that way. Help us to know what is considered a normal menstrual cycle.
Thank you for your question. When we say normal menstrual cycle, it is counted from the first day of one period to the next day of the next period. And then it ranges from, in adults, from 21 to 35 days. And then in adolescent, it ranges from 21 to 45 days. And then the period flows normally from 2 to 7 days.
Thank you so much. So,
And one thing you were saying that everybody is thinking that
supposed
exactly
to
is supposed
yes.
to flow 28 days. No, we should remember that every person is unique, and we are different. We are special in our own way. So everybody's system is different from the way it works. So you cannot, I sitting here cannot compare my menstrual cycle to my sister sitting beside me. All of us, we are different altogether.
Thank you so much. All of us, we are different. So it doesn't have to follow one direction that
Yeah.
every 28 days
Yeah.
it should actually come.
Exactly.
I'm sure this question actually would benefit our parents because it's much of a burden to them. When their girl child is growing, if the child gets her first period, it actually brings some sort of questions to our parents. Either one is wondering it has come too early, and the other is also wondering why hasn't it come yet? Please help us understand at what age typically should a girl have her menses, and when should our parents consider or be much of a concern whether it's too late or it's too early?
Okay, so the age range for normal menstruation is between 10 to 15 years, or 3 years after the development of breast. So if your child's menses starts before 8 years old, I think it's a sign of concern. So you should seek the medical advice. And then if after 15 years your menses too is not coming, or you have not had your menses before, you should also seek for medical advice. The average age that someone should have, or a lady or a young girl should have a menses, is 12 years. But then the range is between 10 to 15 years.
Okay. So averagely, it should be 10
Yes.
to 15.
Yes.
So if it's less than
8 years.
8
Because
years,
some of the ladies, a few of them even menstruate at 9 years. I've had a colleague before when I was in primary who menstruated at 9 years. So those changes, they are there, but below 8 years is a sign of concern. Some even have theirs at 8 years. So when you seek medical advice, I think per more probing, we'll get to know whether it's real menstruation or maybe it is something else causing it. So that's why you have to seek medical advice.
okay, so after this period that she has given us, if your child's own is less than 8 years going, then we should actually know that we need to visit our healthcare providers for them to assist us with why it happened like that. And I think I've realized that in the first few years of a girl child after she has had her menses, you realize the menses becomes irregular. Like it doesn't really follow like that. So my question is it normal? Is it normal for a menstruation cycle to be irregular, especially during the first few years after a girl's first period?
Absolutely, it's very normal because the hormones that um, help with that stage is still maturing. So between 2 to 3 years after menstruation starts for some girls, sometimes it's not regular. But as we keep saying, it might not be regular. If maybe your menses starts and then after 90 days, still you are not seeing it, you can still seek for medical advice, even though we are saying between 2 to 3 years. But if after 2 to 3 years it's still occurring, I think you would have to seek for medical advice and then we see what is going on. So the range is between 2 to 3 years after starting your menses. Yeah.
So after 2 to 3 years, it will become
irregular.
Yeah.
irregular
Yeah.
until the hormones are fully matured.
Yes.
Then it comes back to
But then it's not everybody.
okay.
It's not everybody. I'll use myself as an example. When I started menstruating, I've been consistently menstruating every month. I've not had a month, I've not missed any
Missed a
month.
month.
So it's everybody, we are all individuals, in a individuals, so everybody, and then how their menstrual cycle works. So for some, as I said, they would have irregular menses between the first 2 to 3 years. But for some too, it just flows as normal. Yeah.
It seems she has said it all. You have to know, I said that everybody's body work individually, uniquely. We are different and we are special in our own ways. So you shouldn't be comparing your own. I started my own about 2 years. It has not come. My friend's own, when she started, it is regular. It is not an alarm sign because
Yeah.
of the maturity of the hormone. The hormone is causing the ovules to mature,
Yeah.
so that you'll be able to have your menstruation.
Thank you so much. The conversation is ongoing. I'm sure your questions are being answered. If they are not answered, drop them in the comment section and we'll surely answer them for you. Send in your views when you were a child, as you are growing, how things are going, and they will be greatly acknowledged. Actually, this part that we've got into it, I want all my men to come around, our partners, our brothers, because most often they do not really understand how our body works. So when we are menstruating, they feel like, yeah, yeah, we are doing too much. We are overdoing. Yeah, how I drink. Thank you. Yeah, how I drink. But it's not us. So please come around. Let's understand this together. You know, before our menstruation, 1 week before, we are full of energy. We are everywhere. The following week, we are craving chocolate. We are craving pizza. And within the slightest seconds, any little thing a person does actually annoys us. Like I don't know if it's for
Yes.
It
all
happens to
women
all
It
or
of
some.
us.
happens. So with menstruation, it comes with different symptoms or signs and symptoms. Every lady has, I might have different symptoms from from yours, but then we have some main symptoms that can occur. So, okay.
I was about asking that. You see,
Okay.
all these changes that
Okay.
goes on in
Yeah.
us. What is that? Is there a physical or hormonal change that actually causes our body to go through these changes throughout the cycle?
Thank you for your question. That is during menstruation, out to pregnancy, two hormones are at work. That is the estrogen and then progesterone. But you start from it's a cycle. So you start, you end, you start, you end, you start, you end. By the cycle itself, you start from the menstrual phase. That is during the menstrual phase, that is where the uterine lining is shed and it comes out every month as menstrual blood. Then from the menstrual phase, when the uterine, you will move to follicular phase. That is when the ovaries are maturing the eggs. For the uterine lining, has been shed to rebuild itself.
Yeah.
Then, as time is going on, we'll move to the ovulation phase. You will see that during the middle of the cycle, a matured egg is released. That is what we call our fertile period. That is during this period, the hormone estrogen is at peak. It's very high. So that is the time that every woman who is expecting, who wants to get pregnant, should have an affair so that you'll be able to get pregnant. Then from there, we'll move to the luteal phase.
Yeah.
From the luteal phase, that is the stage that when pregnancy, I would say our sister talked about it at the beginning, that during the body prepares itself for pregnancy. Now we say I wouldn't to receive the ovules, the fertilized ovules. Say if no fertilization occurs and no pregnancy occurs, then the lining is shed and it comes out. Then we come to menstrual phase again.
Hey.
So all these things, everybody's own is different. And when all these processes are going on, so many luteinizing hormones comes in, follicle stimulating hormone comes in, estrogen. So all these systems, prostaglandins is also there. So they will be causing pains, they will be causing mood swings, there will be bloating of the stomach. So like everything, like all the processes, like when you are pregnant for the first time, what you go through. Nti ububophobia wade kaka obi nkan wo kra na ubuefu. Obi ya de eye wehi. Obi kra te ho eye na onkan wo na ubuefu, all because of your mood swings. And then we have headaches. We'll be having cramps, menstrual cramps, all this makes us uncomfortable. And everybody's own is different. People are experience here, experience be. Experience here is severe. There mild. So if your own is mild and your friend is complaining, I'm having menstrual cramp, it's too painful, you think that they are training. But meanwhile, it is not like that. We are special. We are unique. Even twins, you can't compare them. Everybody's system is different from the way it works.
Thank you so much. So you see, my dear gents, when you understand how our body actually works, you know that during that period, it's not easy for us. So if you see us getting annoyed or beating, recently I saw some video online and it's like two partners and they went to buy something from the grocery shop. And I think the lady was about menstruating. So they got back home. She stepped out of the car. Then the husband banged the door to close it. Hey, that instant, the lady is just angry like that. Like the husband is making all of a sudden. Then the husband said, "Oh, sorry. Since we bought your favorite snack, let me help you take the rubber out, then you eat." has the man done anything wrong?
No, it's actually
You know when
normal.
you're removing rubber from biscuits,
Yeah.
that
sound.
sound that it
Yes.
makes,
It
it
was
also annoyed,
irritating
like
her.
she was irritated. So
Yeah.
all of a sudden it's like the man is trying to do good,
Yes.
but ni good in our bonny.
Yes.
So please, I beg you, please try and understand us.
Yeah.
When we are going through this phase, you take your time, have patience for us, then at the end of it all, we'll come back to our normal self, and then we do everything nicely together. You know, most women also ask themselves whether their menstrual symptoms that they are seeing is normal, or they should visit the healthcare providers for them to actually know what is wrong with her. Can you help us know what is considered as normal menstrual symptoms and those that needs to be corrected?
Okay. Thank you.
Or any of you can.
Sure. Okay, so with menstrual cycle, when you're menstruating, some of the normal symptoms that you might experience is bloating. There's tenderness of the breast. You feel like it's as if say yo yakakra, and sometimes it becomes a little heavier than it usually is. And then there's mild to moderate cramps. You can some even
Fatigue.
have diarrhea. Some get constipated. So it depends. Some get fatigue, so tired. Some even get waist pains. I get waist pains. So it depends on everybody. So in all the things I've mentioned, it shouldn't be so severe that your daily activity or daily work is disrupted. So with the pain, with the menstrual cramps, you shouldn't be so painful, severe painful that your daily activities are affected. So when there's that, you have to seek medical intervention. When maybe your menses last for 7 days, you know your cycle, so you know, okay, my menses last for 6 days, it lasts for 7 days, it lasts for 8 days. But then this time around, I've been menstruating for more than this number of days. You have to seek medical intervention. When your menses is so heavy that every hour your pad gets soaked and you change your pad over several hours, it's also an indication that there's something wrong. So you have to go and see your doctor. When you realize that subsequently you are having foul smell from when some discharges are normal, so you know yourself, so you know that maybe this discharge is not normal and then there's a foul smell, you'd have to seek a medical intervention. And then when you realize that after 90 days, you are waiting for your menses, but it's not coming. After 90 days, still it's not coming. You would have to seek, yes, please, medical intervention.
Any more
And also, when you are bleeding in between,
Exactly.
that you do your menses finish today, in the next 2 days you
Yeah,
start
start menstruating again.
having
Yeah.
menses again. And then when you are having sexual intercourse too and you are bleeding,
Bleeding.
it's a call for alarm. So you have to seek your the health provider too.
So all these symptoms, can you say it actually goes through, or every lady faces
Yes.
that?
So you might all the things, all the symptoms I've mentioned. It doesn't mean maybe you are a single person is supposed to experience all the
Everything.
symptoms. Someone can experience all, but it depends on each and every one of us. So maybe you might experience one or two or all of them. So it depends.
Not at
Or
all.
not at all. Some women don't even know they are about to menstruate. They are just there and then the menses comes. So in as much as we are trying to educate the public on this, you should know that everybody's body is different. So you should study your body and know what your system goes through during menstruation and after menstruation.
I think some people even have cold
Yes,
during
exactly,
this
exactly.
period.
That is
Exactly.
your nose becomes so sensitive that
Yeah.
anything that you
Serious.
Yes.
during ovulation and
Yeah.
also menstruation.
Exactly.
I-
Some
I
even
like-
get cramps during ovulation.
Yes, it's true.
It might not be
Yes.
as severe as
Yes.
during
menstruation
menstruation, but then
itself.
during ovulation, some get
think
some
it's
some
at
even
the-
feel. I do feel some as if some electrical impulses. You see, you be feeling it. So you have to study your body and know
Okay.
what is normal for you or what is normal to you.
Okay.
The thing is, when you are ovulating, it's not one side. It's either here or here
Or both sides, exactly.
Okay.
Because the eggs are released either from the fallopian tubes are two, with the ovaries at each of the sides. So it's either two eggs are releasing at the same
Released,
time,
or
or one from each side.
okay.
So that's what happens. Yeah.
And with the ovulation, how will I know that I'm ovulating? Like, what are some signs that will tell me I'm ovulating?
Okay, thank you. One of the signs is that you see that your cervical, we have the normal flora that comes out in our normal flora from our vagina. Yeah. You see that it will change. We call it spin bucket. It will, when you, it is in kruma. What they want saka, what stretch ya, obey who say it will stretch. Ebi so how obey who say ne why body temperature will go up. Yeah. Ebi so honoma ne like just like ovulation, menstruation, like ube feeling for
sex. Yes, so their libido is high.
goes up.
Exactly.
Yeah,
exactly. That is how it is. Because yes, matured eggs have been released, so you are ready. Yes.
So
okay.
this is God.
Yes.
He has made it like that so that you will fruitful. And if you are married or you have your partner, you want to get pregnant, this is the time you, the woman, will be even be calling the man to have sex.
Yeah.
Yes. So it's normal. When you are ovulating and you feel like having sex, it is normal.
Okay, thank you so much. So it's normal for us to. It's normal, but we have to be cautious. If we should follow, we may end up doing it, and at the end of the day, pregnancy will come like, hey, I didn't plan for it to. So in as much, this one, those who are married, we greet you. It's a plan. So I like the way the conversation is going. I'm sure you are also enjoying it as well. Do all to share, like, comment, and let's continue to join and learn together. We were talking about menstrual cramps. What are some of the first aid methods that we can actually do to ease that cramps?
So with the first aid, some have body postures they do that relieves them. Some would say I'm putting my belly on a flat surface. Some would say maybe when I turn on my right side, it's okay. And then some also we have hot water bottles that we can put on our abdomen, massage it, and then it helps to relieve the pain and then makes it easy for the blood to flow. Because during menstruation, it's like the uterus is contracting. So that's why the cramps come. And some also, I think, that's it. Some also have other things they take.
They say when they lift their legs up,
so it depends.
It helps to ease that pain.
So what relieves you or what works for you? So I think I mentioned the hot water bottle, that one mostly. And then the positions, what works for you is what you do.
But when it is severe, that you have to take some medications. That one you have to come to the clinic or the hospital, any hospital around you, go and see. And then you explain, we know what to give to you. So that is why we know what to give, but we are not mentioning it here.
Yes.
So that you go out there and go
and
buy.
Self-medication.
Menstruation is not a disease.
Yes.
It's not sickness. It is something normal that happens to every lady, every woman. So when it happens, like, we don't expect you, other than that, you will be used to. The time that you are having cramps, you just take it. You would like to go and take medication so that you'll be okay. But when you are, you do some exercise, you go up and down, it will let it calm down. You'll be a little bit free. And all this is as a result of the hormones and then the processes that it goes through.
So I think I want to chip something. I forgot about the exercise. The exercise is very important. So we are not supposed to be living a sedentary lifestyle, always sitting at one place, not moving. So if I say exercise, it doesn't mean going to the gym necessarily or something. You should be active. You can just take some walks and all. Just don't be sitting at one place. Yes, there are people who live like that. Do you know?
Yes,
they sit at some place, not doing anything. Even before the message, they are just there. They're not doing eat, sleep, just sit there. So you should make sure you are active. Be active. It helps to relieve the pain.
We have some people. I was having a colleague when I was in the nursing school. For her, during menstruation, she would just lie the whole 7 days.
Lie at one place.
Yes, lie at one place. Not able to do anything. That is why when it is severe, like somebody like this, she needs medication. it's not intentional.
Yes.
The pains that she is going through, sister,
Yeah.
it's
not
not
easy
easy
for her.
So we, the people in the room, will be carrying her water, will be doing everything for her for the
Yes.
whole 7 days.
Wow.
So this is how individual we are, different.
We are different
Yeah.
indeed. So you see,
all together.
we
Now,
are
I would
indeed
like to,
different.
sorry, I would like to chip something little in. So there's fainting. Some people experience fainting. Some people experience severe dizziness. All these are severe forms. So when you are experiencing that, I think you should go to the hospital to seek a medical advice, because sometimes other conditions or other things can be causing that. So you go, they'll do proper checks on you, and then you know whether maybe it's a normal thing, it's normal to you, or maybe this or that is causing it. I don't want to mention some of the things that can cause that, but then other medical conditions can cause all those severe forms of menstrual pains and cramps. So that is it. Thank you.
Thank you so much. So we are individually different.
Yeah.
As we are sharing, you can also go into our comment section, drop your method that helps to ease your cramps.
Exactly.
As they were talking, they were like, we should know ourselves, and it's true. Personally, for me, when I didn't know that if I eat sugary things,
Yeah.
like I was eating everything some, then I realized if I take sugary things, at the end of the day, the cramps become too much for me to bear.
Yes.
So I made up my mind, a week to it, I'll stop eating it.
Yeah.
I'll eat banku. You see the heavy food, yes.
Yes.
So even if I'm doing it and I'm unable to eat, it means my body has fuel that it
Yeah.
can depend on to function. So
Very
please,
true.
let's do well. Know yourself, know your cycle, and everything will be fine. So my next question, it seems you wanted to say something.
Saying, as you are saying, know yourself. In case they have any question, they can come to any, whether the community that now we have Chiefs Compound, we have
Health centers.
You just go. If you have any question, it's not something that you have to feel shy about. You just come to us. Come and ask us what is bothering you. Because we all started the same.
Yes.
That we have been, that we'll be able to explain it.
You see, your health really matters indeed when health matters. So the conversation is still ongoing. You know, sometimes life gets so busy that we have exams to do, deadlines to meet, some family responsibilities. My question is in two folds. One, does our period actually notice that we are going through all these stresses? And does this stress in any way, in addition to changes in our lifestyle, the diets or foods that we eat, does all these things like have an effect on our period?
Yes, they have a significant effect on our periods.
Okay.
When you are stressed, when you are exercising excessively, when you are obese, all these things, obese means your BMI is more than the normal BMI. You are bigger than you are supposed to be. When all these things come into play, it either disrupts the hormone levels or interferes with it. So when the hormone levels are disrupted or interfered with, it either stops ovulation, and when ovulation doesn't really take place, or when there's a disruption in any of the phases, it can delay your menses.
Okay.
And in as much as it can delay the menses, it can make the menses come earlier than expected to. So that's how it works exactly. And then what was the other question?
No,
I
is it,
wanted to
I wanted to, okay.
also affect our emotional status, also
Yes.
have
Obviously.
interfere with
Okay.
our menstrual
Menses.
cycle.
Yeah.
When you lost a loved one,
Yeah.
it can change it. When you travel or change of job, you don't know how to
Environment.
go about your things. You don't know your environment. All these things affect it. So when you see that, even though we have said that the period is between 21 to 35 days in adults, and you have seen that no, this time I had my menses, that was last week, and within the next 1 week I have had it, it doesn't mean that there is a problem. It's because of maybe the changes that have come, that is what has affected it. Or the whole month it has passed the 35, it has gone far more than 35, it doesn't mean that there is a problem. When you are going through all this, that is why we are all like, you have hospitals and health workers. You just go and tell them what is the age, then we will monitor it, your period for you, and know that no, this time it's because of this issue that you had. That is why your menstrual cycle changed. But it's not because you are having an issue. So as time goes on, you will see that as you are becoming comfortable and becoming aware of your surroundings, it will become normal. Be able to flow.
Hey, but this is serious, right?
Yes.
Uninvited guests coming to our house
Exactly.
with a whole lot of terms and conditions.
Yeah.
Like they'll teach you what to eat,
Yes.
what not to eat.
Yeah.
It's serious.
Yes.
Hey, God help us. And most often too, some women also find it actually difficult remembering the exact date. Be like, hey,
Yeah.
was it this Tuesday? The day that my mother gave me this thing. Ɛyɛ na ɛyɛ den sɛ yɛbɛkae particular dates, So kindly help us. How can women and also girls track their menstrual cycle effectively? And why is this tracking actually important?
So we have some methods or some ways you can track it. We can use the calendar. You can have a diary to yourself, and then we have apps on our phones. Either if you are using Android on the Play Store, you get apps there. When you are using App Store too, there are apps there. So a particular app I use is called Eve, EVE. It helps you to track. It helps you to track your menstrual cycle, depending. So maybe if I had my menses today, there's a way to indicate on it I've had my menses, and then it calculates everything for you. If you want to use the calendar too, I think I'll use the opportunity to teach you how to calculate your menstrual cycle. So let's say you are starting with January, your menses starts, and then you take the date. You wait. The following month it comes, you take the date. March it comes, you take the days, and then the following month you take it. So let's say we have an average about 3 menstrual cycles. So you have the 3 menstrual cycles. You count the first day to the next time of your menses. You count the number of days in between those days. If it is 28 days until your next period, you write it down. Then you check for the other month. If it's 26 days, you write it down. And you do for the third one, and then you write it down. So with these 3 number of days, you divide by 3, and then it should give you an average number of days that your menses comes. Even though some people mostly have, oh, mine is 28 days, strictly 28 days. Some also, it's not strictly 28 or 22 or 27. So sometimes it might come a day before or a day after. So it's not, it doesn't necessarily mean that it should come on that particular day. And as we said, a lot of other factors can influence when the menses come, even as much as we know that this is the number of days my menses is supposed to come. So that is how we calculate it. Have I missed anything? Is there any other question? I think that is it.
Yes. And I was also asking, why is the tracking actually important?
Oh, it is important. It helps you to know your body and understand how your menses work. So I forgot the diary one. So with the diary too, it helps you to note the days, note the symptoms that you experience, and all that. So when there is something different, maybe this month comes and then this is different, you know that, oh, I didn't experience this the other time. This is new. And then you track it and you would watch and see what happens. If it's something that is going towards somewhere you don't understand, then you now seek medical advice. So all this is important to help us so that if there's anything going wrong somewhere, maybe my menses or my usual cycle is 28 days, and then after 40 days, it's still not coming, then maybe it comes. Then subsequently, it's changing. There's still an issue. Then you know that, okay, this is not right. This is not how it's supposed to be. Then you can think exactly. You can seek for medical advice. That is why it is important.
Thank you so much.
You're welcome.
Okay, I would like to chip in this. When you are having the poor have distracted.
So if you could help us, she explained knowing your cycle and then why it is important. So,
So
the
I wanted to
fertile
chip.
period and the rest.
Exactly.
I wanted to chip in this. When you have, as I've been saying, to say the American, we are different individually. We are unique on our own. Everybody's cycle is different.
Yes.
So knowing what I wanted to say, it will also help you to know your fertile period.
Yeah.
Okay. Thank you. So when you know your cycle, when you monitor it for 3 consecutive months, then you divide it and then you know yourself that my own, I have my average menstrual cycle is 21 or 22. That is when you are going to use it to calculate your ovulation period.
Yes.
So you don't say that they said the average ovulation is 14 days. So I will calculate automatically on my 14th day, I have to. On my 14th day, I have to ovulate. No, my own is different, your own is different. So it is important that each and every individual, every adolescent, every woman, you should be able to know your average menstrual period so that you can use it to know your ovulation period, where it is danger, where it is a fertile period for those who are expecting to get pregnant, and where it is danger for we the adolescent that we've been hiding to do some things that we are not supposed to do. So it is very important that you can, if you don't know how to do it, go and see your healthcare worker, explain it to them, they will calculate it for you. You send your 3 months. This period, I had it 21. The next month, 21. The next month, 21. They will divide it, calculate when you are fertile, when you are not fertile, so that in case to when something is going wrong, you'll be able to detect it earlier. Thank you.
Thank you very much. I like the way the conversation is actually going. So it means that when we know our cycle, that's when we'll be able to detect whether we are free or we are fertile or anything is what actually is going on. Okay, so with the fertile period, like is it before or is it after? Can you help us understand?
So as she said, it's a cycle, right? But then usually, if I would say, it's after menstruation.
Okay.
After menstruation, the egg would have to mature. The eggs that are in the ovaries. There's an ovary, and then every month an egg matures. One of the eggs will mature and then release. So when it's released, that is what we call ovulation. It's released and then it comes into our womb and waits in our womb and be waiting for a sperm to fertilize it. As it is released, it's a matured egg, and that is ovulation. Ovulation has started. So within that time, we still have, within the ovulation period, we have a peak period and then a period where it's not as peak as. So there's a peak period within the, if your ovulation is within 7 days, the peak period might be in the middle. So it depends, or a day to the end of ovulation. So it depends. So that is the ovulation period. It's after menstruation. When the egg matures and it releases, that is ovulation.
So it will go through the 4 stages, all the phases.
Yeah.
That is when is the peak period, when the estrogen is at peak.
Yeah.
That is when you ovulate.
I'm sure you are liking the way the conversation is going. What questions no yearly answer mo and I be or what still yen no ma wa yen ken ya comment section no fato ho ye befa na ya ma mo aye a ose no fata ye betua conversation no today ye ni nipadua nkai ni na our menstrual cycle also benefits from some healthy habits be aye. So my question is, what are some of the healthy habits that when we do, it can help support regular menstrual cycle?
That's a nice question. So I'll mention some, and then if I forget any, my colleague will also help me with the rest. So there's balanced diet. We call something balanced diet. You should eat properly. Eat your proteins. Make sure any food you eat should contain your protein, your carbohydrate, good proportion of all those things, your fruits, your vegetables. And then, because if you eat and you don't eat your fruits, the body is not able to pick up the necessary nutrients needed to help with your blood volume. So when you're anemic, you might not menstruate. Mostly when your blood level is very low, you realize that that month, your menses either does not come, or when it comes, instead of maybe it coming for your usual period or number of days, it's like 7 days, maybe to come like 2 days. And all those things are not healthy. You should make sure you exercise. As I said, be active. Don't be sitting at one place. And then being active, I don't mean exercise excessively, because I remember mentioning that when you exercise excessively, it can disrupt your menstrual cycle. Either you not menstruate at the time you're supposed to menstruate, or you menstruate earlier than your menstrual cycle. And then you get enough rest, you sleep well. When you are stressed, you should be able to sleep to manage. Is it only sleeping? I think anything that you should take yourself away from, anything that stresses you, anything that you realize stresses you, you should take yourself away from that. And then what else? I've forgotten something.
That is, if you are smoking.
Yes,
you should
exactly.
avoid
Smoking and excessive drinking. As for drinking, we can't say you should stop. People will not stop. So you should limit it.
But
Reduce
surprisingly, to current research is showing that
Yeah.
you don't even need about 0.5%.
Yes.
But still,
But yes, you can't say, oh, stop. As for the smoking, we can say stop. But the drinking, I think it will be difficult for people to stop completely. Because with alcohol, we find it in some of our foods too. So
Some people have been stopping.
Oh, some people have been
some
stopping.
people have actually made it a habit,
Of
like
course.
they are
So if you
addicted.
say-
That one is what
Exactly.
So
you're talking
it will
about.
If you
take,
say
just like
stop-
it will take time.
It will take time, but not to. Anyway,
But you
so
know,
please, if
you-
you can
you-
stop, stop. If you can stop, stop. But if you can't stop to just reduce, limit it.
You mentioned that there's some foods that, yes, there's a
Yeah.
percentage in. They know we need that. So they have actually calculated it,
Yeah.
and then they've given us the exact percentage that we
Yeah.
need. But for the drinks that we will be taking, they haven't
have
really
percentage.
calculated
Yeah.
that my body needs 0.5.
Yeah.
They say
They
with the
just
boom.
give us anything.
Yeah.
So please, as she's saying, but let's try and then do our possible best.
And I want to stress on something like the food that my sister was saying. It
Okay.
is good that, because fruits, they help in the absorption of iron. So it is good and when we look at the available fruit in season. It is cheaper. So that one you can buy it. Orange, at least 1 CD, 2 CD after eating, you take it, which will help any iron in the food that you have
Yeah.
eaten
Yes, the
help
oranges.
to absorb it so that you'll be able to build your
Yeah.
HB.
Thank you
Your
so much.
hemoglobin.
So please send in your comment to our YouTube channel, and then we'll surely attend to them for you. They have mentioned a lot, and just as I used myself as an example, know yourself. The kind of things that when you eat, it becomes harmful for you, then you actually stay away from all those things so they do not become harmful.
They should maintain a healthy weight.
Exactly. I
Maintaining
forgot that one. Yeah.
Health-
But you know,
Healthy
this obesity thing currently is becoming more of a trend, though.
It's becoming a trend, but it's
Especially the
killing us.
children that are
Yes.
up and coming.
So you see, with everybody, we call something BMI. Your weight might be 70. I can also be 70. But if we go and check our BMI, I might be overweight, and then you might be in the normal or in the normal weight. So if you can't calculate it, I think you should come to the health facility. They'll help you. Yes, and then know whether you are in the normal weight, because someone might look plumpy, but then when
they
they
are
check,
not.
yes. So we use the height and the weight and all that to do the calculation. So you are taller than me. So probably I might be 70. You might even be 80, but we'll go and check, and then you are in the normal range. Exactly. But
You'll be obese.
yes, I will be overweight, or I might be obese. So it depends. So you should maintain a normal weight, but don't say that, okay, maybe me or body or anything. I mean, quite exercise. No, that's not what we mean. by maintaining a healthy weight. Thank you.
That
Thank
is
you
why
so
we are
much.
always available.
Yeah.
So parents, we are telling you people you should be Bible says lack of knowledge my people perish.
Yeah.
You will think that, oh, I'm feeding my baby well, I'm giving it, so my baby is growing very. So these
Yes.
days every 3 months from birth we calculate the height so that we'll know the BMI of every child. When the child is getting obese, we'll be able to alert the parents, or underweight, we'll be able to alert the parents so that they'll be able to do something about it early before it gets to.
So please, let's try and then check the kind of foods that we eat. It will also help to reduce our weight.
The children.
Throughout the conversation, we've been making this comment, know yourself. If you do know yourself, that's when you'll be able to understand how your whole body actually works. And this is to our dear guys and then our partners, our gents, our gentlemen out there. Please, if possible, try and know the cycle of your woman. It's a plus for you if you actually do that, because when she gets to that stage where she's actually going through all those mood swings and others, you wouldn't say that, hey, me girl, and I'm me saying it's either you are overdoing. It's not like she is actually overdoing. It is what is going on as we've been taught now. And all year, they are all year. So please be patient with us and work or collaborate with us. We are bringing our conversation to an end. It's been an awesome conversation. So before we end, I would like you both to give us your last comment each as we are about ending.
Okay, so what I would say is that we should know and understand that we are individuals in as much as we are all ladies. I don't expect to have the same symptoms or the same experiences as another. So I keep encouraging that you know your cycle, you understand what goes on in your body, and then through that you'll be able to when some of these symptoms and all others are happening to us, we can have people who will be able to support us in our community, in our own settings. So I think that's what I'll have
I
to
think
say.
our sister just, sorry, before, I've seen one person just commented, my menses is just 3 days every cycle. Is it normal?
It's
Yes,
normal.
please.
As I
It's
said, it's
normal.
between
Tell
2
you
to 7 days.
The flow is
Yes,
between
2 to 7 days.
So it's
So
normal.
3 is normal.
It
Okay.
becomes abnormal when you see that maybe when I was in the adolescent, I started, my flow was 3 days, and it continues 3 days, 3 days, but along the line it has changed. It come 4 days, 5 days, and it go at times more than 7 days. Then you have to know that you have to go to the hospital to go and ask them, or to go and find out the reason why all these things are happening, because it's not normal. When it starts 2 days, it has to continue till menopause. If it is 5 days, it continues till. If it is 7 days, it doesn't change. So when you see that it has changed, it has been changing. When at first I was having 3 days, but now I do it for 5 days or 7 days or more than that, then you have to go and see your healthcare provider so that.
I think someone is asking this question, but I think we've actually said through the conversation that it was ongoing. The person said, how should we handle ladies who go through the extreme pain during their period to ease the pain? So I think she's talking
Okay,
about the
hers is
cramps.
extreme. She's saying extreme pain.
Oh, okay.
Yes,
Okay.
so with extreme pain, as we said, she has to seek medical advice, because other things, some naturally have extreme pain or severe pain without any other medical condition causing it. But right now you are not sure, so you have to seek medical intervention. They do all the checks they have to do, and then they clear you. If it's not any other medical condition causing the extreme pain, they will let you go. But if it's something else causing it, they would have to treat you and then help you with that situation.
Thank you so much. So just as our sister have just said, to the extreme, Personally, I remember some time ago when I was growing up, they had to send me to Efekwanta
Yeah.
for me to take drip.
Yeah.
Like, they gave me infusions because I was menstruating. That was
You were in
because
severe pain.
I was really in severe pain. We're in
Really?
hot water bottle,
Yeah.
and but since that time, and we went and everything
back.
was sorted. Now it's
That is
back
it.
to my
Yeah.
normal
Yes.
way. So let's do well
You
too.
become dehydrated, you don't take in enough water.
Yeah.
That
You don't
one
even
too.
eat.
Yes,
Yeah.
it's true. I
So all
wasn't.
these things can affect it.
Yeah.
You will not feel like it, but at least take something small. You take in a more water too, it will help to
Help
ease the
you.
pain.
Maybe the water, the warm water also actually
Yeah. So you do what works
helps.
for you.
What works for
Exactly.
you. So please keep on dropping what actually works for you, and then it will be actually be recognized. So you see, if we do understand ourselves well, that's when you'll be able to answer all these questions that are coming. Someone is also answering, I thought menstrual cycle differs from every lady and how they react. That's
Yes.
true.
Yes, very true.
Very
We
true.
mentioned it. Every lady's own differs.
different,
Exactly.
Yes.
It's different.
Every lady. That's why
Yeah.
you are unique.
Exactly.
I'm
So
unique.
unique.
We are
Yes.
all
Unique
unique
and
in
special.
our own way. So please do well to keep the comments coming. We truly appreciate your participation throughout the conversation. So you were about giving your last.
Okay. My last word to everyone is that we must know our cycle. When you know your cycle, you'll be able to know your fertile period. You'll be able to know when you are in danger so that it wouldn't end you in pregnancy. Or when you are expecting. Some up to now, they don't even know when they are ovulating. So they will come and say that, Madam, please, I'm married, I've been trying now, but the thing is not working. By the time you finish teaching the person, the next one, and the person will get pregnant. So please know yourself. Know your cycle. If you don't understand anything, come to us. Anywhere that you go, whether in the hospital, health center, CHIPS compound, all the health providers there, they will teach you how to go about. Don't be shy. Don't hide it. Feel free, especially the adolescents. If you are going through any challenge, talk to your mother. Don't talk to your friend.
This is
Talk to
very
your mother,
Yes, it's very
so that your
important.
mother will
Very
bring you
important.
to the health facility and will take care of you, and everything will be fine. It is something normal. So when it happened to you, don't think that it's something that is breaking you because of the cold, because of the headache, because of you. Feel free, use it to work, exercise, do something small, not extreme exercise.
But something
Walking,
small.
go to the kitchen, help your mother in the kitchen. Even if your mother is pounding, help mother to pound the fufu. By the time you finish pounding, you see that you'll be fine. It will ease the pain.
Someone is saying that men also go through same. So I'm wondering,
How are they
That
going
one
through
is
it?
not true.
men also
You should
go
explain
through.
to us how they are going
So
through.
please, at Eric Pra 9605, please come and then share your view on this one. He said men also go through
This
the
one there is
same.
not
So I'm
true.
wondering,
Because menstruation occurs to only women.
only women.
You
Only
should come
you
and
don't
explain how
Is
it
ovulate.
it
goes through
like
it.
we have some men that
You don't have a womb. So please, you are not part.
or
You don't go
there's a
through
condition
anything.
that men go through that they also have what do you call it? Cramps at their
No.
No, they
penis
don't have
or
any
Then
something.
cramps.
then he's sick. He or
No,
she
no,
is
no,
sick.
no, no.
If you are having cramps,
Apart,
it's or pain, it's you are sick. Go to the
yes.
hospital.
Yours is not what we are.
Yes,
It's not
it's
a
not
cramp.
natural.
Maybe
It's just
maybe
some
he's
pain
talking
or
about the changes during adolescence. They go to the bedwetting on those kind of things. That
oh,
one is
okay.
different. You
The
don't go through any
broadening of
pain.
Yes,
chest.
No.
it's
Oh, that
different.
one
We
is
No,
all
no,
go
no,
different.
no,
We
through
no.
all
it.
go through
Exactly. We
it.
also go the breast
Our
and
own is
the pubic
menstruation.
hairs and stuff.
After we've grown the breast, the
Yes.
hips, and everything,
We also go.
there's another thing that goes on that makes
Yes.
us unable to understand our body.
Yeah.
So
Hormonal
please,
changes.
this today, please come and then explain to us for us to actually understand.
For men, they are free. They don't have any.
It's really serious. So, I think there's another comment here that says, at this point, I think God should bless all the women because they go.
Exactly.
Thank you, our brother.
Exactly.
Like God
God
bless
should
you.
bless
Go
us.
through
It's
a
not
lot.
easy. It's not easy.
Seriously.
It's not easy.
You are sitting at your somewhere. You didn't invite anyone. The
Yeah.
person just comes and they spoil your mood,
Yeah.
your appetite. Like,
It's not
God
easy.
bless us and give us strength because,
Yeah.
hey,
Having chills, having cold,
oh,
feeling feverish.
You be nauseated. You don't feel like eating. Oh.
Just like that. God is
it's
wonderful.
just too much. Indeed, God is actually wonderful because, hey, if God is not, like, we wouldn't have been experiencing what we are actually discussing today. You know,
Beautify our body too.
it's
Really,
true.
yes.
Like,
Exactly.
It makes us
I'm a living
beautiful.
testimony to
Especially when
that.
you're
When you are
ovulating.
ovulating,
Yes, you look
Your
more, your
skin.
your
skin.
color
Yeah.
looks like I feel I will feel outside
Yeah,
that back.
exactly.
And when my friends meet
It's
me,
all
they're
to,
like,
you see, God is wonderful. You know, around that time when you have sex or you have intercourse with a man, you can get pregnant. So it's to
yes.
attract.
Yes.
So especially when
Okay,
you're exactly
okay.
because with
You
God's
become
intention,
beautiful.
we are supposed to what? Procreate,
Yes,
right?
yes,
Exactly.
yes,
So that
yes.
is it.
So
You look
that
more
when the men
sumptuous
look
and
at us,
It's like,
yeah.
sometimes I just get up, I'll look at myself in the mirror, I
Yes.
can see my face
Yes.
glowing.
very
Yeah.
I
beautiful.
step out, hey, why I feel? I
Yeah.
say,
It
who's
beautifies.
about? It's not
Yeah.
my sikao, it's ovulation.
It's the hormones.
Ovulation and hormones that is actually making
The
us
Yeah.
hormones.
look that pretty. So all thanks to God for making us this special. So you
Yeah.
see,
You see that when you are getting to the menopause, when the hormones they are wearing out, you
then
see
you
that
see that,
you are
hey,
becoming ugly more. Go ahead, our mothers.
it's not easy.
Getting
They
the,
were once
yes.
like us. It's true.
So
So I
many
don't think that
changes will
I
be
don't
going
think the
through your
right
body.
word. I don't think the right word is
Ugly.
ugly.
No, it's
You'll be
not
like,
ugly. You
Yeah,
see
we are
that
actually changing.
you'll be
exactly. You are
changing.
changing.
Yes.
Yes.
You see
Hormones
that you
and
will
our
not be
beauty.
as when you
Beautiful
were
as-
menstruating.
Exactly.
And the estrogen, they've been doing so many things for us. You be all those arthritis and those kind of that's a
Exactly.
result of
Yeah.
them not working again.
Yeah.
So that is it.
But God bless our men as well. Because they are also suffering.
Yes, they are
Like the
suffering
story
to
that I
put
was
up with
saying.
us,
Hey,
with the way we behave.
biscuit wrapper. She's
We get
irritating.
angry
Yeah.
anyhow.
Like the next time we there, like, you see her beating the
It's not
husband. Why?
easy.
Because she's
Sometimes when
menstruating.
you're mentioned, you don't even want to talk to anybody. You are not in the mood.
Sometimes with the ladies, they do it intentional.
Some of
You
them do
don't
it.
go that far. I mean, because you are in pain. But this is natural.
Do you have menstrual cramps? Do you have
Oh, I've
severe
been
menstrual
experiencing,
cramps?
but not severe.
Exactly.
Yes,
If it's
but
okay, you
I've
don't
been
know.
having
Severe one.
menstrual
You don't want
cramps.
to
You
talk. You're like
understand?
you are not
The little
interested in
thing
any
you
con.
slap someone.
Exactly. When someone calls me, I just like it's irritating. It's irritating.
Hearing your
So
phone ring itself
exactly.
is
So
irritating you.
it's some way, but we will go through it.
So that is why we are teaching. They have to endure. And they have to.
God give us the grace to endure. But I'm still wondering why. Well, the men's own data are one of our viewers said that they also go through. I'm wondering what actually will make them have that cramps.
Oh, they will not
Like
have
No,
cramps.
men
As my
are,
men,
sister
no.
said, when you are having
it's
cramps, then
serious.
it means
You
that
are
there is a
sick,
problem.
so go to the hospital.
Ebi
Yes.
ana nipa no or Sabina ni yem
Exactly, because this
or
should be
it is
Or
something
that.
else.
umbilical hernia
Hernia,
or
any
those kind
other
of
thing.
things.
So you have to
That's
go to the
for
So
hospital.
please, if you are listening to us and then you are a man or you are a gentleman and you are feeling this pain, please do well to visit your healthcare providers for them to actually go run some
Investigate.
labs, investigate and find out what actually is causing that pain that you are feeling. It's been an awesome conversation so far. I really enjoyed the whole conversation. Me, my questions were answered. If yours are not answered, please keep on sending them and we'll surely attend to them for you. Thank you so much, our wonderful guests.
Thanks for having
We are
us.
looking that we will have you on the show more.
Okay.
Yes, it was actually a great time. And to you, our lovely followers, our viewers, like, we don't know what to say. This wouldn't have been successful without your presence and your participation. We say thank you so much for being with us. If this session was actually helpful to you, Please do well to share it. Share. This one is share the link. This is Health Matters, share the link. Health Matters, share the link. For others to also benefit, your colleagues, your friends, your families, anyone at all. Yen nyina yensu adumbum. Yenti yen nimpedua ase. Na yentim yenye decisions a obeboa ama yen apomuzin etim esipi na wakone nim. But you know, if we don't even take care of ourselves well, infection can come
exactly.
in. And this is what we'll be treating in our next topic. Next week, same time on this show, we will be discussing about myths and some practical tips that we need.
Yes.
Am I correct?
Yes, that's it.
Thank God. I think I've tried a little for us.
You've not tried, Rory. I've not tried.
So, Madame Doreen Jinjo.
Hobby, yes.
So, they were here to help us understand, knowing your cycle, understanding menstruation, and what is normal. See you same time on our next episode. Bye. Please wait a minute.